Is it appropriate of someone to receive a second opinion for their AML?
It is always a good idea to get a second opinion. There is nothing anybody should feel slighted about. I am a leukemia expert, and if I willingly tell patients, I discuss everything. I said you are free to seek a second opinion. Patients should feel comfortable that they get the right treatment, their right clinical trial. It is always a good idea to get a second opinion. And these days, with all the hopefully telemedicine, which hopefully is here to stay for a little bit longer, you can get opinions quickly. You don't really have to um, wait for the records to be transferred and this and that. So it's always a good idea to get a second opinion.
Why should a patient get a second opinion before choosing a treatment option?
So what's different about AML from a lot of other cancers is that it's very intense. And often people are diagnosed in a hospital because they end up sick. And so typically smaller hospitals will not treat AML. They will transfer patients to larger academic centers. So most likely you will get an AML expert to treat you. What's also different from other cancers is that we don't have a lot of time. So often we need to start treatment fairly quickly. So if you're in the hospital and you were unfortunate and you were diagnosed with AML, it's hard to get a second opinion at that time because that would involve a transfer to a different hospital. It's not impossible, it could happen, but it's difficult to arrange. And typically, depending on the presentation of AML, so there's different situations, but usually we want to start treatment fairly fast within days. So second opinion at that point is difficult. Second opinion is a good idea after you leave the hospital and when you're deciding about treatment options that's going to happen next. So for consolidation, for example, and that's a good time to seek a second opinion. So some big academic hospitals will do telehealth second opinion, so that's an option. Um, Another option is to reach out to these big places that are well known for AML and see if they'll accept the transfer as reach out as a patient or as a family member of a patient if that's important to you. And so, like if you're somewhere in rural places and maybe there are not that many options. Historically, AML was always considered an emergency. So if a community oncologist diagnoses AML, so somebody comes in with low blood counts, they do a bone marrow biopsy, they diagnose AML. Patient is not necessarily that sick. They would send patient to the emergency room immediately to be admitted. What we know now is that for a lot of patients, we have a little bit of time. Like we can wait, get all this information that we need. If patient is stable, sometimes we can even keep them outpatient. So that's what we're learning now. There are definitely situations with AML where there is no time to wait. And this is usually when the counts are high, when the white count is very high. And so these patients need treatment immediately. So they have to go to the emergency room and they have to get started on treatment immediately. So in this situation, time is definitely precious and you don't have a lot of time. But even in the sort of slower progressing cases, it's different from other cancers. It needs to be treated quickly. So maybe not days, but a week or two is the maximum that we will wait usually.